Nursing Process Fundamentals Exam Questions and Answers. Question 1. A nurse receives a new postoperative client from PACU. The client reports pain of 8 out of 10 and has a saturated dressing. Which nursing process action comes first? Option A. Document the pain score. Option B. Assess the dressing and vital signs. Option C. Administer the ordered analgesic. Option D. Teach splinting before coughing. The correct answer is option B. Assess the dressing and vital signs. Assessment is the doorway to every safe decision. Before acting, the nurse gathers focused clues because pain plus bleeding may signal a changing condition that needs rapid priority judgment. Question 2. A student nurse writes, "Client will walk in hallway today." Which revision best makes this outcome measurable? Option A. Client will ambulate 50 feet with assistance by 1500. Option B. Client will improve mobility as tolerated. Option C. Client will understand why walking matters. Option D. Client will try to walk after breakfast. The correct answer is option A. Client will ambulate 50 feet with assistance by 1500. A measurable outcome gives the care plan a clear finish line. Distance, assistance level, and time turn a vague hope into a target the nurse can evaluate. Question 3. A client with pneumonia says, "I feel worse today." Which response shows the nurse is using assessment rather than jumping to implementation? Option A. I will call respiratory therapy now. Option B. Let me check your breathing, oxygen level, and temperature. Option C. You probably need stronger antibiotics. Option D. Try to rest and drink more fluids. The correct answer is option B. Let me check your breathing, oxygen level, and temperature. Assessment listens before it moves. The nurse collects fresh data first because a small complaint can hide a major change in oxygenation or infection status. Question 4. A nurse determines that a client did not meet the goal of maintaining blood glucose below the target range. Which step of the nursing process is this? Option A. Diagnosis. Option B. Planning. Option C. Implementation. Option D. Evaluation. The correct answer is option D. Evaluation. Evaluation is the mirror of nursing care. It compares actual results with expected outcomes and tells the nurse whether to continue, change, or escalate the plan. Question 5. A nurse identifies impaired skin integrity related to immobility as evidenced by a stage 2 pressure injury. Which part of the statement is the evidence? Option A. Impaired skin integrity. Option B. Related to immobility. Option C. Stage 2 pressure injury. Option D. Nursing diagnosis label. The correct answer is option C. Stage 2 pressure injury. Evidence is the visible footprint of the problem. It shows what the nurse actually observed, making the diagnosis stronger than a guess. Question 6. A client newly diagnosed with heart failure has edema and shortness of breath. Which nursing diagnosis has the highest priority? Option A. Activity intolerance. Option B. Excess fluid volume. Option C. Deficient knowledge. Option D. Risk for loneliness. The correct answer is option B. Excess fluid volume. Priority follows threat. Fluid overload can strain breathing and circulation, so it rises above teaching or psychosocial concerns when the body is asking for immediate help. Question 7. A nurse teaches incentive spirometer use and later asks the client to demonstrate it. Which nursing process step is the demonstration check? Option A. Assessment. Option B. Planning. Option C. Implementation. Option D. Evaluation. The correct answer is option D. Evaluation. A return demonstration is evaluation in motion. It reveals whether teaching landed or simply passed through the room like sound without meaning. Question 8. A nurse is creating a care plan for a client at risk for falls. Which action belongs in the planning phase? Option A. Identify fall risk factors from the chart. Option B. Set a goal that the client remains fall-free during the shift. Option C. Place the call light within reach. Option D. Review whether a fall occurred. The correct answer is option B. Set a goal that the client remains fall-free during the shift. Planning builds the map before the walk begins. A goal defines the desired safe destination so interventions can be chosen with purpose. Question 9. A client refuses morning care and says, "Leave me alone." Which nursing action best reflects the assessment phase? Option A. Ask what is making care difficult right now. Option B. Document refusal and return later. Option C. Explain that hygiene prevents infection. Option D. Notify the provider immediately. The correct answer is option A. Ask what is making care difficult right now. Assessment searches for the reason behind the refusal. Fear, pain, fatigue, or culture may be speaking through resistance, and the nurse must hear the message first. Question 10. A nurse clusters care to allow a fatigued client longer rest periods. Which nursing process step is this? Option A, assessment. Option B, diagnosis. Option C, implementation. Option D, evaluation. The correct answer is option C, implementation. Implementation is where the plan becomes action. Clustering care is a deliberate nursing intervention that protects energy, like saving battery power on a stormy day. Question 11. A client has acute pain after abdominal surgery. Which expected outcome is best written? Option A, client will be comfortable soon. Option B, client will report pain of 3 out of 10 or less within 1 hour. Option C, client will receive pain medicine as ordered. Option D, client will know pain control methods. The correct answer is option B, client will report pain of 3 out of 10 or less within 1 hour. Strong outcomes are specific and measurable. A number and time frame help the nurse judge whether care worked instead of relying on vague impressions. Question 12. A nurse notices a client's urine output is 20 ml per hour after surgery. Which action shows clinical judgment within the nursing process? Option A, record the finding at end of shift. Option B, increase fluids without checking orders. Option C, assess vital signs and notify the provider as indicated. Option D, tell the client urine may be low after anesthesia. The correct answer is option C, assess vital signs and notify the provider as indicated. Low output can be an early alarm for poor perfusion. The nurse reassesses and communicates because kidneys often whisper before the body shouts. Question 13. A nurse collects data, identifies a problem, sets goals, performs interventions, and checks results. What concept is being used? Option A, nursing process. Option B, medical diagnosis. Option C, delegation chain. Option D, incident reporting. The correct answer is option A, nursing process. The nursing process is the engine of safe care. It turns scattered facts into organized decisions that protect patients from random, untested action. Question 14. A client with limited English proficiency appears confused about discharge instructions. Which nursing process action is most appropriate before teaching continues? Option A, use a certified interpreter. Option B, speak louder and slower. Option C, ask a family child to translate. Option D, give written English instructions only. The correct answer is option A, use a certified interpreter. Understanding is part of safety. A qualified interpreter turns teaching into true communication, preventing discharge instructions from becoming a locked door. Question 15. A nurse reviews a care plan and removes an intervention that no longer applies. Which principle is demonstrated? Option A, care plans are fixed once written. Option B, evaluation guides revision of care. Option C, only providers revise nursing plans. Option D, implementation ends the nursing process. The correct answer is option B, evaluation guides revision of care. Evaluation keeps care alive and current. When outcomes change, the plan must change too, like adjusting the sails when the wind shifts.